Actual case study. Josh is age 6 months. He weighs 6 kilograms and his temperature is 38 degrees. Josh has been brought to the clinic because he has diarrhea. First, check for general danger signs. The mother says that Josh is able to drink, is not vomiting, and has not had convulsions. Look to see if Josh is lethargic or unconscious. Is Josh lethargic or unconscious? Write down your assessment. Does Josh have any of the general danger signs? Now assess Josh for the first main symptom, cough or difficult breathing.
Does the child have cough or difficult breathing?
Josh does have a cough.
For how long?
The mother replies, for 3 days. Count the breaths Josh takes in 1 minute. Prepare to start counting. Start counting now. Write down the number of breaths you counted and decide whether Josh has fast breathing. Now look for chest in drawing. Whether chest in drawing is present. Assess Josh for stridor. Look and listen now. Assessment process for cough or difficult breathing. Now use the information to classify the illness. Child has diarrhea. The mother reported that Josh has diarrhea. Next we ask,
For how long has Josh had diarrhea?
the mother replies, 5 days.
Is there blood in the stool?
There is no blood in the stool. Now, write down your assessment of the signs of dehydration. Look at the general condition of the child. You have already assessed Josh to see if he is lethargic or unconscious when assessing for general danger signs. Now assess whether the child is restless and irritable. What have you decided? Look for sunken eyes. Write down what you decide. Would you say that Josh is not able to drink or drinking poorly? Would you say he was drinking eagerly and thirsty? Or does he drink normally? Write down what you decide. Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Or slowly? Or immediately? Write down your decision. That completes the assessment process for a child with diarrhea. You should now use the information to classify the illness. Look at the chart for diarrhea and classify Josh's diarrhea. Josh is age 6 months. His mother told us she had brought Josh to the clinic because he has diarrhea. First, we assessed Josh for general danger signs. Josh was able to drink. He was not vomiting and did not have convulsions. Josh was not lethargic or unconscious. Josh does not have any of the general danger signs. What did you decide? Next, Josh was assessed for the next main symptom, cough or difficult breathing. Josh's mother said he had been coughing for 3 days. We counted 56 breaths in 1 minute. As Josh is age 6 months, he has fast breathing. Josh does not have chest indrawing. We could hear no harsh sound as Josh breathed in. Therefore, we decided that Josh did not have stridor. Josh has a cough with fast breathing. We will classify Josh's illness using the classification table. Look at the signs listed in the pink row. Josh does not have a general danger sign, chest indrawing, or stridor. He has no signs of severe pneumonia or very severe
এখানে একটা
disease.
ছোট্ট কথা বলি, এই ইয়েলো বক্সে কিন্তু দেখো চেস্ট ইন ড্রয়িংটা নাই, বরঞ্চ চেস্ট ইন ড্রয়িংটা ব্লু পিঙ্ক বক্সে চলে গেছে। এটা অনেক আগের, তো অনেক আগের আইএমসিআই, এখন কিন্তু এটা এই চেস্ট ইন ড্রয়িংটা ইয়েলো বক্সে। ঠিক আছে, চেস্ট ইন ড্রয়িংটা ইয়েলো বক্সে, এটা দেখে কনফিউজড হয়ো না। ঠিক আছে,
জি ম্যাম, জি ম্যাম।
থ্যাংক ইউ।
So we look at the next row down. His sign of fast breathing puts him in the yellow row. Therefore, we classify Josh as having pneumonia. We moved on to assess Josh's diarrhea. Josh has had diarrhea for 5 days. His mother said there was no blood in the stool. We assessed Josh's dehydration status. We looked at the child's general condition and decided that Josh was not lethargic and was not restless and irritable. We looked at Josh's eyes and decided that the eyes were sunken. Although Josh took many sips, he was not very eager in his drinking. When pinched, the skin on Josh's abdomen went back very slowly. Josh has sunken eyes and a skin pinch which goes back very slowly. Sunken eyes and a very slow skin pinch are both signs of severe dehydration, placing him in the pink row. Because Josh had diarrhea for only 5 days, he was not classified for persistent diarrhea. Because he had no blood in the stool, he was not classified as dysentery. We would therefore classify Josh as having diarrhea with severe dehydration. Josh, therefore, has pneumonia and diarrhea with severe dehydration. What did you decide?